to the Atherosclerosis podcast, the series hosted by the ES Young Fellows. My name is Yusuf Sener, and I am currently pursuing my PhD at Department of Cardiology at Thorax Center Erasmus MC. Today, we will have an interview with our esteemed guest, Jeanine Roeters van Lennep. She is currently an associate professor, but is in the process of being promoted to full professor. So, hopefully she will be a professor as you listen to this interview, and I will refer to her as a professor during the interview. Professor Jeanine Roeters van Lennep is head of the lipid clinic specialized in hereditary dyslipidemia at the Erasmus Medical Center, Rotterdam, the Netherlands. Her scientific research is dedicated to cardiovascular prevention, specifically diagnosis and treatment of familial hypercholesterolemia and sex-specific cardiovascular risk factors such as preeclampsia. Hello, Professor Roeters van Lennep.
Well, thank you, Yusuf, and it's a great honor to contribute to this series of Atherosclerosis interviews. My name is Jeanine Roeters van Lennep. And I'm an internist vascular medicine, which is the same as preventive cardiology. It differs between the countries, but in the Netherlands, we call it internist vascular medicine. And I have been working in Erasmus MC here in Rotterdam since 2010. And I combine clinic with research and also, as you mentioned, some leadership roles.
Yeah, what an admirable career. And could you describe a typical day in your life and explain how you balance your research with your leadership?
Oh, thank you. And actually, I've been thinking about this question because I knew it would be coming. And there is not such something as a typical day for me. And that's why I really like my work. I have 2 days of clinic. I have one lipid clinic, which I do myself. And there I see, it's a family-based clinic. So I see both children and adults with especially hereditary dyslipidemia. And even today I had my clinic and I saw a daughter and her mother and her grandfather. And that is so special to see like a whole family. And I really believe in that is working and that you can really provide the most optimal care in this way. But I also have a clinic, which I co-founded together with a gynecologist, especially for cardiovascular prevention for women who had severe preeclampsia. But then my day can vary a lot. It can be that I have meetings with my PhD students, or we make new plans for new exciting programs. I have collaborations also internationally and nationally, so then we meet up, mostly virtual, but sometimes also we meet in person because that's very important for collaborations. I do some teaching, and then as you already mentioned, there are, sometimes meeting for the Cardiovascular Institute or for the Women's Health Institute. And then we really make plans how to move.
About your academic journey and what led you to focus on atherosclerosis, dyslipidemia, and sex and gender medicine. Was there a certain time point that made you think that, yes, this is my path?
Yeah, that's also an interesting question because actually, and I think that most people who have done these interviews, it's sometimes it's just something by chance. And of course you have to help chance. But when I started to study medicine, my father, who's a cardiologist, read something about that women with cardiovascular disease were not taken seriously and that they were undertreated. And as a cardiologist in a small town in the southwestern part of the Netherlands, he thought, well, I am not aware that I'm treating women differently than men, but maybe somebody should do some research on it. So what about his daughter, who was just studying medicine? And as a side job, what I did is that I took care of their database with all the patients that they performed a coronary angiogram on. And he asked me, can you take a look and divide women and men and see if we are using this procedure later in their disease, or what do we, is there follow-up after they had their coronary angiogram? And to his relief, we found there were no differences once they were referred to the cardiologist. But then, when I was doing this research, I met an internist in Utrecht, and she was doing research on ApoB, on lipids. And she knew there was this database, and she was very interested to work with it. So she approached my father, and he said, well, you have to talk to Jeanine because she takes care of this database. So that's where I also got into lipids, and I helped her with her PhD, and that was one of the moments that actually formed my interest in lipids and women and cardiovascular disease. So it was already when I was a student. And then because I thought that the study of medicine was a bit boring. We had most of them, there were like lectures with 300 people. It was not very interactive. So in my free time, I helped people with research and was interested in this women thing. So also with my own data, well, not my own database, it was the database of my father. I tried to do research, and there I met the professor of cardiology in Leiden, because that's where I studied. And he thought it was quite funny, such a young student who was very interested in research. So as a side project, he encouraged me to write papers. And then after a while said, well, you've written 4 papers already. During your study, maybe you can make it into a PhD. So when I was 24, I did my PhD. It was before I was an MD, which was quite unusual by then. But then it was quite more difficult for my career, because when I was young, everybody was super enthusiastic. Well, this young student who is interested in this crazy subject of women and cardiovascular disease, well, she can make a thesis out of that. But later on, I had to do my internships. I was training as an internist interested in preventive cardiology. But during my training, the focus was very much on the clinic. And it was really not kind of allowed to do research. Even more so because during that time, I had my children. And then, according to, my supervisors, I was a young mother. I was in training. I shouldn't bother about research anymore. So it was quite difficult. However, when I finished my training, my husband, who's also a cardiologist, I'm really surrounded by cardiologists, he got a job in Rotterdam. And then because I really like to do more academic work, and then I just applied for maybe to have a job for me in Erasmus MC. And then I was lucky because there was a job, and it was about lipids, which I still loved. And I thought, well, I'm interested in this women and cardiovascular disease. So whatever, I will do my research on women and cardiovascular disease then, and also on sex differences, which was not encouraged very much. They said, well, if you can do it as a side project, as a hobby, then it's okay, as long as you concentrate on the serious works. But I still continued to, because that was my passion, to combine lipids and women cardiovascular disease. And eventually I did more and more projects. So I had to start all over again with research. But, now you can maybe just say that it was a good choice to stick to this subject that was really driving me.
It's a lovely story. And if you were starting your research career today, what would you do differently given the current scientific landscape?
Yeah, I mean, I didn't plan my career at all. It was just something that happened to me. And I think for now, and also that's what I have my PhD students who are interested in research and who like to continue and maybe have a career in research. I think that, I didn't plan anything. And maybe it's good to have a mentor and to have somebody who can guide you more into what's important. Maybe you should do a research visit to another university or in another country. Maybe you should apply for grants in time. And even if you don't get them, it's very educational to know how to write a grant. And when I had my career, nobody told that to me. I mean, I was the student. I did it just in my spare time. I didn't even know what grants were. So in that sense, I think that it would have helped if I could have, make more like a planning in my career. I mean, in the end, I got there, so it was okay, but it could have been more easier for myself, especially.
You have already mentioned about mentorship, but as you know, mentorship plays an important role in many successful careers. Did you have any mentors who influenced your path?
Yeah, well, at the beginning, I had this mentor. She was called Tineke Westerveld. She was working in Utrecht as an internist, and she did her science next to her research, next to having a clinic and having also a young family. And that inspired me very much because she showed that you could combine this, and it was not impossible to have a family and also to do research and also to do the clinic. And also the professor in Leiden, who really, Ernst van der Wal, he really learned me how to write a paper, which is, of course, very important if you want to do research. And also, both of them learned me that research is fun. That it's about good company and then you get so much energy.
Yeah. And now that you have your own trainees and mentees, how do you approach mentorship? What qualities do you think make a great mentor?
I think that, of course, now also having learned what I went through, I think that it's important to also mentor other people, and it's very important to they're not mini-me's. They're all their own individuals with their own interests and strong points, and maybe also things that they have to work on. But it's also up to them in the end. So the young people who really want to go for a research career, I really try to involve them in as many programs as they like. On the other hand, you also have to take into account that there's a difference now between the work-life balance and when I started my training. So I have learned also in mentorship that, I mean, I love my work and my work is my hobby and I can do it like, okay, maybe it's not healthy, but I work like 60, 70 hours per week and I don't mind because it's my hobby. I also like to work in the evenings, don't mind, or also not in the weekends. But I realize that especially with the current environment, you can't expect that from other people. Maybe they do have a weekend, or maybe they have other hobbies as well.
Yeah, of course, thanks. The next question is about EAS. How has being an active member of the European Atherosclerosis Society affected your life outside of EAS?
Yeah, well, it was also, that was a kind of a coincidence because I read that there were positions open for the executive committee, and I called Kheirkhah because he was then the president, and I said, well, what do you think? Should I apply? He said, well, I mean, you can try, of course, but it's an election. And then I wrote my letter to express my interest. And then I saw that there were about 10 people applying for 3 positions. I got a bit scared because I looked at their CVs and their bios. I thought, wow, I mean, if I would have known this and that these people would have applied, then I wouldn't have even dream to hand in my letter. But then I got elected as a member of the EC, and we had such a wonderful EC, and there were so many different people, and it really expanded my my horizon just to get to know these people. I mean, of course, sometimes you knew their name, but really to work with them, that was a great experience. But also, and that's the EAS is a very open and inclusive society. That's my experience, and of course, I had my agenda, and it were women and cardiovascular disease. So, and they were the EC was very enthusiastic also to adopt this theme. And then I called Lala to Kheirkhah, and I asked her, I mean, you have these consensus papers, and what do you think? Do you think it's possible to do something about women and cardiovascular disease? And she said, yes, this is a great topic. Let's do it. Let's ask Kosh if this can be the next consensus paper. Kosh also loved it. And he said, maybe it would be even a better idea to have only female authors. So, and that was an excellent idea, because there's very often still, and it's mentioned if they need a speaker, then the first 3 names are male speakers. And of course, they're good. But then they said, and if you mention, well, maybe we can also have a female speaker. So, we don't have any female experts. I really don't know any. So we showed by this, because we published this EAS call to action about women, atherosclerosis, and cardiovascular disease in the European Heart Journal. And then we really showed, I mean, there are so many women experts. So you never can have this argument like, I can't find any female speakers on this topic.
Yeah. And you are an expert in cardiovascular disease in women. Do you think sex and gender plays a role to understand and potentially treat cardiovascular disease? Can you comment on the main research and clinical unmet needs in this field? And in your opinion, which are the main knowledge gaps in this scenario?
Yeah, I think that there are so many knowledge gaps, and also really straightforward one. I mean, we know women experience cardiovascular disease about 10 years later than men. And everybody says, well, that's because women are protected, or kind of protected, from atherosclerosis before menopause. But how does it actually work with the hormones? I mean, we always focus on estrogen, but there are also other female sex hormones which play a role, like progesterone, FSH, SHBG. And in this interaction, so for the basic scientists, how does it affect the immune system? I mean, there's so many questions. Like even women, even if when they're born, like baby girls, have higher cholesterol levels than baby boys. And and we just see that it's observational, but we still don't know how does that work. Why is it that nature gave baby girls a higher cholesterol than baby boys? And also, it's throughout when they're about 18 that women have higher cholesterol levels. Then until about menopause, men have higher cholesterol levels, and then it reverses again. So this whole life course is important. But also, from the clinical point of view, I mean, women are always, very often, they're undertreated. So is it the physicians and the healthcare providers who do not prescribe women the guideline-directed medication? Is it the women themselves? They don't take the medication? And what is driving this? I mean, we can have a whole podcast about the unmet clinical needs. But especially, I think that for the young fellows and young researchers, whatever field you're researching in atherosclerosis, be aware of taking sex, and if you do clinical research, also gender into account, because you will really find more, and maybe you can help to solve the puzzle.
Thanks. In addition to sex and gender, inflammation is also becoming more and more important to understand, prevent, and treat cardiovascular diseases. Sex hormones are known to shape immune responses and inflammation. Could you please share your ideas about the triangle of sex, inflammation, and cardiovascular diseases?
Yeah, that's also because we know that women have more autoimmune diseases, and also that their immune system gets activated sooner, and that also sex hormones play a role in that. So I think that it is, especially inflammation research in atherosclerosis, essential to take into account sex and also hormones. On the clinical side, if you take a look at the clinical trials, there is always an underrepresentation of women in the clinical trials. For example, in the Lodoco study, there were not even 15% of the participants were women. And that was at the start of the study. And very recently, we also looked at the follow-up during the study and how many of the study participants stopped their study medication. And also there we found that women more often discontinued their study medication during the trial compared to men. And this was similar for the women who were attributed to placebo or to colchicine in this sense. So it was not really that they had more side effects or there was a sign that it was a side effect, but it is something else. So maybe it's the study procedures, or maybe it's because women in general report more side effects. And I think that in the end, if we want to prescribe women the drugs that have been in a trial, then it's also very important to have enough women in the trial to also take a look, like, are they having the same characteristics as the men, or also like the women in the end that you will be treating. And very important that they are, if they are in the study, if they're randomized, that they finish the study.
Yeah, maybe you answered these questions just before, but do you think there's still a gender bias in cardiovascular research, and how can we ensure more equity and in research funding and study design?
Yeah, well, I think that is also important, because especially if you're studying women's specific aspects, such as menstruation or pregnancy and lactation or menopause, it's still quite difficult to find funding, and especially because these are regarded as subjects for gynecologists. But I think that women's health is, these aspects of women affect many other organ systems, including cardiovascular and atherosclerosis. So, and it's quite difficult to find funding for that. Regarding study design and trials, there are also the leadership. I mean, if there are more women in the steering committee, in the leadership, then, and that's also proven, then you have also more female participants. I don't know how it works. But also there, I think that in general, more an inclusive environment in research and in trials that will provide in the end better quality research.
Yeah. Now, I have a few questions about future perspectives. Do you see artificial intelligence and machine learning playing a bigger role in personalized risk assessment for cardiovascular disease?
I mean, of course, on the one hand, I think that this it can solve some problems. For example, also, if you make risk calculators and involve a lot of proteomics and a lot of biomarkers, Also, in imaging, it's very interesting to use AI. But we also have to be aware that AI can have faults. And also, for example, if you look at sex and gender, there are biases, and that can be reinforced by AI. Also, if we take a look at personalized medicines, what I think is very interesting is it's not only like the biology, but if you really want to change healthcare, you also have to look at the like maybe what scientists find most often the most boring part or less interesting part, and that's what is happening in the clinic. And so we have had a lot of those studies showing that the guideline-directed therapy is underused, and that people are not on their target levels, and well. But it's on the one hand, it's like, why do the healthcare providers, why do they not prescribe the drugs that are recommended? But also on the patient side, we always focus on cardiovascular death, cardiovascular events. But for patients, maybe other outcome measures are very important. And so in that sense, I think personalized medicine, really, if it's personalized, then you take also into account the outcome measures that are important for a patient. And that's something that is beyond AI.
Yeah, thanks. And with the rapid advancement of technology in medicine, what skills do you think young researchers should develop to stay ahead?
Yeah, also that. So I think on the one hand, it's important to know something about AI, about machine learning, also about e-health, because also there, how can you use it? And also to make e-health more inclusive, because right now you have to have the digital skills, and it's very important also not to lose a certain population because maybe they don't have the digital skills, or if they don't manage the language very well. And on the other hand, I more and more work together with psychologists and to do qualitative research. And qualitative research learns you a lot. So I also think that researchers, clinical researchers, of course, if you're basically researchers, it's something else, but clinical researchers, it would be very valuable to learn something about qualitative research and not only quantitative research.
Thanks. You have been involved in several activities regarding social media. What is your vision about social media for research and academia? Do you think social media could be useful for patient education?
Much, yeah, especially in the world where we're living, and there is so much fake information. And also, when I'm in a clinic, I experience it very often, and it's logical. But patients look on YouTube, they look on Instagram, and there are a lot of influencers who are providing false and fake information. I mean, we know fake information and in healthcare and about the deleterious effects from the COVID pandemic. But I think it's like almost equal because it's going on and on in the cardiovascular field. For example, about statins. There are so many books, influencers who state that statins are toxic, and it has an effect on patients, very much so. And I think that in that sense, the academic world, the social media ambassadors we have at EAS, but in general, everyone who is doing research and who's on social media can play a role, even if it's a small role, but really providing good information to patients. And if everybody would do that for a little bit, then it really would help. And it really, I mean, I think that it would really save lives to do so.
Thank you very much. Now we are coming to an end, and I ask you a few questions more. Could you please share your opinions regarding how can young scientists ensure their research has a real-world impact beyond academia?
Yeah, I think that one, well, maybe we just talked about an example like this, but also for me, impact is very important. And we do our research and then we publish it, and very, very often then it's finished and you go to the next project and the next project. For me, I think it's very interesting if you have done your research, have published it, but then also look beyond and like how can you implement your research. And of course, maybe if you're a young researcher, you don't have to do it all yourself, but reach out to your mentor, to your supervisor, and talk about this. Like, I mean, we found this. How can we make the next step towards the patient?
Thanks. Publishing research can be daunting for early career scientists. Since you are a co-editor of Atherosclerosis, what strategies have you found most effective for getting research published and noticed? Do you have any advice on handling rejection and feedback from reviewers?
Yeah, rejection. That's something that you have a famous BMJ paper about, like, I reject your rejection. And sometimes if there's a young researcher and the paper's rejected and they're really furious, then I send them to this paper just to make them laugh. It's just that happens. I mean, I think that what can help is to look like what did the reviewers have as feedback. Also, what helps is really, I mean, it's very basic, but just look at your title. Because sometimes a title can be quite important. If your title is super specific, just also mentioning like this precise region where you did your research, that's you want to be comprehensive and precise, but on the other hand, also, well, make sure that it's interesting for a more broad audience. And of course, the research question is super important, but also how you did your research and how you present your research. And for me, like as a clinical researcher, like the clinical message, like what does this mean for healthcare?
Now that we are coming to our end, we have a section dedicated to failures, which we call the graveyard of ideas. Most of the time, we only hear success stories of other researchers, which makes some of us question ourselves. We want all researchers to know that failure is part of the process, so we decided to ask everyone in this series of interviews to contribute an idea to our graveyard of ideas. This could be a story about a grant you were passionate about, or any kind of failure you faced during your academic journey. So what is your contribution?
Yeah, well, I mean, I had enough failures, so there's a wide array I could mention. But one of the failures I think is interesting is my Big Five project. I got a grant from the Dutch Heart Foundation, and what I wanted to do is to look at a net clinical benefit of the Big Five, like the cardiovascular drugs that you receive after you had a myocardial infarction. So the beta blockers, the P2Y12 inhibitors, aspirin, statins, and ACE inhibitors. And I want to do like a sex-specific clinical benefit. So look at the efficacy of these drugs and look at the safety. However, when I started, then it was already, especially with the older drugs, okay, but still I could find the sex-specified efficacy. However, it was impossible to find the sex-stratified safety because the studies did not report side effects stratified by sex. So then in the end, we had one report out, a meta-analysis about DAPT, and kind of like the sex-specific and clinical benefit, but then the other ones, it was impossible, but it really made me realize the importance of really having those data out there And even if it's an appendix, it doesn't matter. But now it was impossible also because the studies were quite old and sometimes the researchers were already deceased to find this data. But, well, I mean, it was an interesting idea. Maybe later on other people can try it with newer drugs.
And finally, we also want this podcast to inform our listeners about open positions in different academic institutions around the world. What is the process for international candidates to become a PhD student in your department? Do you usually announce your open positions, or would you encourage researchers looking for a PhD or postdoc position to write directly to the labs they are interested in?
Yeah, in my field, because I do mainly clinical research, their proficiency of the Dutch language is quite important. So for international students to do like research in my group is quite difficult. However, I really work together with a lot of other people. That's also why I love research, and a lot of those researchers have international students, and so in that sense, I really would advise just to reach out. Sometimes I do get mails, and then just looking at the profile of a specific person, I pass them on or call somebody, say, well, I have this person, and maybe I'm very interested very often in women-specific aspects or sex-specific aspects. Say, well, do you have a project? Maybe we can take somebody on. And sometimes it happens. So it's really worth trying.
Yes, thanks. And this was an really incredible and fruitful interview. Thank you, Professor Roeters van Lennep, for sharing your time and insights with us. Also, a big thank you to all our listeners. This podcast is for you, and we need your feedback to tailor it to your interests. Again, thank you very much, Professor Roeters van Lennep.
Thank you.